Today on Ask Your Doctor, I managed to visit the Kiambu Dental Care where I have a dentist and we will be talking more about the tooth cavity. I am Singa Nyambura and let's take a look on the tooth cavity.
My name is Dr. Frederick W. Mungai, a dentist of 34 years since I qualified. To answer Cynthia very simply, a dental cavity develops because of tooth decay. Tooth decay is caused when people eat refined carbohydrates and they do not brush their teeth as regularly as they should. Ideally, you should brush your teeth at least 2 times a day. That is in the morning after breakfast and in the evening after supper. Most people who I have interviewed, they develop decay because in the morning they blush when they wake up. Because there's a bad taste or a bad smell in the mouth, they just go ahead when they are taking their shower, they brush their teeth. That is a big mistake because the idea behind brushing is to remove the food debris or the food particles that remain after you have taken your meal. So it doesn't make any sense to brush before. So when those food remain in the mouth, and then in every organ of the body there are bacteria which are called normal commensals, or the bacteria that live in that organ and cause no disease. But now, when there are food particles remaining on the teeth, especially between the teeth, then they are invaded by these bacteria and the byproduct is acidic and it's the one that now corrodes the teeth and starts eating the teeth and causes a dental cavity.
Yeah, as you have said that not brushing your teeth can cause tooth cavity. Are there other causes of tooth cavities?
There are other causes.
Can you briefly explain to us?
I will very briefly just touch on 1 or 2. There is another problem, like here in Kiambu, we have a lot of people who have fluorosis. When your teeth are fluorosed, cavities tend to just occur by themselves. They don't need a lot of provocation, they don't need bacteria, because this is because of the chipping away. We call it enamel hypoplasia. The enamel just chips off and you find that the teeth now have cavities. In fact, you might find that the cavities are not due to decay, but because of the enamel hypoplasia, and they could be all over on all the teeth. Okay?
Yeah.
That is one. The other thing is bruxism. Bruxism is when you grind your teeth together. There are people who at night clench their teeth and they grind their teeth. Now, depending on the formation of the teeth, because teeth have different shapes, especially the ones behind, you will find that that tooth is eating away the other tooth, and immediately the tooth is eaten away, you reach what the softer material called dentine. So it's very easy now for that tooth to develop a cavity.
As you have said, those are the causes of the tooth decay of the cavity. And how can one know, like, his or her tooth is developing that tooth cavity, or what are the signs?
There are early symptoms when your teeth start developing a cavity. The earlier symptoms are your teeth start becoming sensitive to cold and hot things, right? So that should warn you that there is something unusual happening in my mouth. Because as the cavity develops, further than that, then you now start experiencing pain with sugary things, salty things. Beyond there will now be pain that will be unprovoked. You know, it just comes without any provocation. Okay? Because if we look at the structure of the tooth, when the decay is in the enamel, there is no symptom. But as it goes deeper and comes nearer to the dentine layer, then that is when now sensitivity starts. Because the dentine, when you look at it microscopically, in the microscope, it has microtubules. And in those tubules, there are what we call small nerve endings. So immediately you approximate those nerve endings, the teeth now, they experience that because of the cold and hot, you know, you can sense the cold and hot because you are near the nerve endings. As it goes deeper, the moment it hits the dentine, then now you start getting pain. As it goes deeper, as it nears the pulp, the inflammation now goes to the pulp, and the pain now can't even respond to painkillers.
And are there stages of tooth cavity?
Yes, that is what I was just explaining. There are 3 or so stages as you go towards of the development of the tooth cavity. The first one is when the decay is in the enamel. Immediately the acids are being produced, you start experiencing corroding of the enamel. It takes a long time because the enamel is quite hard. Enamel is harder than bone. Yeah? So it takes not less than 3 years for the cavity to penetrate the layer of enamel. But the moment it hits the dentine, then the progression is quicker because dentine is softer than the enamel, and the pulp, which is the innermost layer, is much softer. In fact, it's a soft tissue. Yes.
Thank you. Are there any prevention of cavity, or what can you do to prevent tooth cavity?
The best way to prevent dental decay, or what you're calling tooth cavity, because the cavity develops when the teeth decay. The best way to prevent that is just maintaining good oral hygiene. By brushing regularly, brushing according to the technique that your dentist has taught you, because most people also develop cavities because of the long brushing technique. There are people who just are very loud, they are very vigorous, and they brush like this, you know. And you find just near the margin of the gum, the brush has eaten away the teeth and they have started forming cavities. Okay? So there is an ideal way of brushing. Ask your dentist, or since I'm here, maybe I can explain to you very briefly. You're supposed to hold your toothbrush at an angle to the teeth. Yeah? It's not to be like this. It's supposed to be at an angle. And then you're supposed to brush in small circular motions. Small circular motions as you go towards the end. And then on this side again, small circular motions as you go towards the end. On the inside, sweeping strokes like you're sweeping outwards. Here in front, like you're bringing your brush out. Again on the upper side, sweeping strokes. Don't forget the biting surfaces until you reach the end. Okay, especially the end, because you know decay in most Kenyan adults starts with the last molar. It's usually the last one to come, and it's usually the first one to get affected because it's not very effective in chewing. But when you chew, you find that most of the food debris goes towards your at the back. You can eat chocolate today, but after 3-4 days, you hear the sweet taste of chocolate. Unashinda ilitoka wapi? It's coming from where it was hiding near the last or the wisdom teeth.
And can you stop tooth decay or the tooth cavity at home?
Yes, with good brushing technique and regular brushing, you can get what we call arrested decay. If you are careless with your brushing and then now suddenly you have really improved, the bacteria will cease eating your, especially when the decay is still within the enamel. But beyond the enamel, there is no way you can reverse the process that has already started. So the other way is to visit your dentist and you get what we call a filling.
And can you explain to us how you can treat this, the tooth decaying or the tooth cavity? What are the treatments of?
Okay, there are various treatments, especially if the decay is within the enamel. You can do a permanent filling. If the decay is within the dentine, there are various chemicals that we use to cover the dentine. Yeah, like the most common one, the one that we use mostly is called calcium hydroxide. It is something that is put on the dentine, and it causes what we call secondary dentine regeneration. The layer of dentine that was there, if it was very thin, it glows thicker because this thing is provoking. It's like a catalyst. It causes the cell that lay down dentine to increase, to multiply. So they make the layer thicker. So if there was penetration of heat or cold, then that is stopped. So at the earlier stages, we can do a permanent filling. Beyond there, then we do what we call root canal treatment. Yeah, we kill the nerves, especially when the decay has reached the lowest part of the dentine, is very near the pulp, because that causes the bacteria to go and cause inflammation at the apex of the roots. Okay, We call that periapical pathology in our terms. Or you have an abscess forming at the root, where the apex of the root is. When you have that kind of scenario, you must do root canal. You extirpate or you remove the bulb, put some medicine there, then you give somebody general antibiotics like amoxicillin, and it helps kill the bacteria. It's bactericidal, so it kills the bacteria, and you come now up and do a permanent filling. It's usually a 3-appointment treatment. Root canal therapy takes 3 appointments, and yeah, you get that sorted. If the tooth has broken, maybe it's broken and it is beyond repair, then you can recommend extraction and then subsequent replacement of the skin.
Yeah, and how often do we have to visit the dentist?
Ideally, you should visit a dentist just for a regular checkup at least 2 times in a year. That is what is recommended by the Kenya Medical and Dentist Practitioners Board. My name, as I say, is Dr. Frederick Mongai. I am located in Kiambu, near the Kiambu main stage, Twiga building on 2nd floor. This is the same building where Deakin College is. We're normally open from 8 up to 6 every day, Monday to Saturday. So you're most welcome. You can call us on 0742 755 057. Again, I repeat, you can call us anytime for an appointment. To book your appointment on 0742 755 057. You are most welcome.